This is a presentation on knowledge and attitudes of tutors on active teaching and learning in health training institutions in Uganda. On introduction, according to NOC, education quality improvement includes a shift from the traditional teacher-centered teaching towards a learner-centered approach. And Angel 2010 argues that the interaction between teachers and students greatly influence learning and motivation. Therefore, education in schools and colleges with greater emphasis replacing teachers with active teaching and learning strategies and engaging students in discovery and scientific process improves learning and knowledge retention. That is by Beabazaire et al. Problem statement. Globally, there has been a realization that many health professionals cannot effectively manage the health problems of their patients and communities because they are not adequately trained in some essential competencies required for their jobs. Gaps in key competencies, including effective communication skills to patients and families, as well as professionalism, were described in medical education programs. This led the institutions adopting competence-based medical education that was to be achieved through use of active teaching and learning approaches. Specific study objectives: to establish the tutor's knowledge level on active teaching and learning process in the health training institutions in Kampala district, and to determine the tutor's attitude towards active teaching and learning process in the health training institutions in Kampala district. Justification of the study. Literature showed gaps in the researches done regarding active teaching and learning in health training institutions of Uganda, despite the development of competence-based curriculums hinged on modular system, that is by Matwa 2013. The study aimed at establishing if tutors have clear knowledge on active teaching and learning and assess their attitude. Therefore, the study will contribute in promoting effective use of active teaching and learning at every point of lesson preparation and teaching, with the purpose to improving education for better learning. According to Stewart, Meyers, and Kale, 2009, tutors' knowledge on active teaching and learning approaches from an innovation point of view changes the pace of the classroom and are on creative way to increase students' involvement, motivation, excitement, attention, and perceived helpfulness and applicability of the class. Bonwell, in his research, adds that from a cognitive perspective, experientially taught students may engage in higher order thinking such as analysis, synthesis, and evaluation. Jim 2010, in his research on using active learning instructional strategies to create excitement and enhance learning, found out that the major concerns that affect tutors' attitude towards use of active teaching and learning approaches are the approaches are time-consuming during the preparation of the lesson, and in classroom, in that the tutor cannot cover as much content in the time available. The study used descriptive and cross-sectional survey designs for data collection that was in October 2016, using a questionnaire from 40 respondents selected using purposive and random sampling techniques. And the data was analyzed using SPSS and presented in tables and figures. In the results, 85% respondents had clear understanding of active teaching and learning. 2.5% trained tutor at degree level was not conversant with active teaching and learning, followed by 5% trained tutor at diploma level and 7.5% non-trained or clinical instructors. Trained tutors seem to have a clear knowledge on active teaching and learning. In the results, tutors at degree level gave more responses about advantages of active teaching and learning to students, followed by tutors at diploma level, with 15 responses about different advantages of active teaching and learning to students. However, the clinical instructors gave 5 advantages of active teaching and learning to students. Trained tutors were knowledgeable compared to non-trained due to lack of training in teaching methods or pedagogy. This is supported by Essay 2013, who found that 59 trained tutors studied in Nigeria were knowledgeable about the benefits of active teaching and learning to their students, and were implementing it than the non-trained. The tutors and clinical instructors' attitude in regard to active teaching and learning. Clinical instructors had less positive attitude towards active teaching and learning than tutors. 80% of the respondents believed that active teaching and learning improves students' learning, with 85% of the respondents believed they can synthesize other tutors about active teaching and learning. 80% of the participants are still comfortable to teach using lecture method. The researcher found out that majority of tutors have a favorable attitude towards active teaching and learning than clinical instructors. This is supported by Bahanam 2008, who reported that clinical instructors who were trained in pedagogy usually apply ATL in their school in Nigeria than those who had not got an opportunity to be trained in teaching skills. Though tutors did not complement active teaching and learning, their attitude towards active teaching and learning seemed to be positive. Tutors and clinical instructors need to be sensitized, and health training institutions administrators need to motivate and encourage tutors to use active teaching and learning methods. And in references, these are some of the few references that I used. Of course, for presentation purposes, I could not put all the references here. Thank you for listening.